Okay, I think I'm live right now everywhere. Okay, so good morning, everyone, and good evening, some of you as well. I think it's almost morning also in Canada and US because it's middle of the night right now. Sorry for the delay because I'm facing actually a little bit connection problem today. And that's what makes me delay. So just so you know ahead of time, if in case the class get disconnected, I'm going to send another link into your WhatsApp, hopefully, if it works still, right? Yeah, we are having a bad weather here today. So just because of that, I'm facing this problem today right now, but hopefully we will make it today. Let me just see here. I hope my voice is audible to everyone. You guys can hear me. It's everything all clear so far. Let's see here. Yes? Okay, good. Now I'm going to start sharing the screen right now. So let me do that pretty quickly with you guys. And if you cannot see the screen, let me know right away. I'm also live right now on the YouTube. So YouTube students, try your best to participate in the chat box. And if in case you have any doubt, any questions for me, you let me know. So welcome back, everyone. We were doing cardiovascular system. We already started this session yesterday. So those students who are very brand new to my channel, try your best to watch the part one also in your free time because we discussed few medical conditions yesterday. And in today's session, I'm going to discuss DVT and then venous insufficiency and peripheral arterial disease as well. And apart from that, we are going to practice some questions today. Okay. It's not a really huge and big session today, but still we'll try our best to study as much as we can. But if you have any doubt, any questions during the class, try your best to type in the chat box for me, or you can raise your hand, those who are using right now the Zoom class with me, or the students who are right now watching me on the YouTube, you can also participate in the chat box as well and always type your doubts and question which you have. Now, let's get started without wasting the time. So the first topic we have here today is the DVT, right? Now, what is DVT? Simple meaning of the DVT before even we read about the medical definition in here, the definition from the books, right? So simple meaning of DVT is what? Clot, blood clot. You know, when the blood is just getting thick inside and make a clot, right? That condition we call is the DVT in a very simple language. So if you want to remember one word for your exam, DVT is equal to clot, right? That will still help you to solve your answers, right? But let's talk about more in detail now, like about the DVT condition, what it is and how does it happen? What are we going to do in here as a nurses, right? So the DVT condition is basically, it is a formation of the blood clot, as I said, which means thrombus formation. Now, where it happens inside the body? In a deep vein. Usually those veins, the one which is in the legs, and the most common, the one we have is the femoral, popliteal, or iliac veins. These are the three most common sites where you are going to see the clot actually in there, in that deep vein. And this DVT, the clot, when it becomes in there, that is definitely a bad if it happens because it can travel also and it can go to the lungs. So if it goes to the lungs, it can lead further problems as well, like pulmonary embolism, which is another medical emergency as well, where the patient cannot breathe enough as well, and you have to do something right away if the clot goes in there in the lungs and get dislodged in the lungs, right? So this is definitely problem can happen, the PE, pulmonary embolism from the DVT, right? We will also discuss more in detail the pulmonary embolism when we will do respiratory system chapter. And the respiratory system, I think it's coming after cardio. We will do endocrine system, then we will do respiratory system. Okay. So at that time, we'll discuss more in detail some nursing interventions related to pulmonary embolism. But for right now, this is a simple meaning of what is the pulmonary embolism look like at the same time. Now, when the DVT happens, it mainly happens due to three different conditions, the three reasons behind, you can say, right? Those three reasons we called, in a simple language, you can say Virchow triads, however you want to pronounce it. Some people, they call it like Virchow. Some people, they call it like Virchow, whichever accent you guys want to use it, as long as you're understanding in there when you're reading about it, right? So this triad, as you can already see in the diagram, it makes like a triangle. That's why we call it like a triad. And these three factors which we have, which cause further basically DVT, the first reason you can say, when the veins, the venous, they actually not having enough blood supply in there, basically. And that condition we call venous stasis. It's usually happen when someone is not moving enough. You know, you sit on the bed all the day, couch on the day, you sleep all the day, you don't have much activity to do it, or maybe due to some medical condition, or maybe someone had a surgery. So after that, someone has a prolonged bed rest, or maybe if you're taking a long flight, right? And you don't have, a space to move and walk somewhere, right? So in that cases, this thing can also be happen as well. The second thing we have here is the endothelial injury. Endothelial injury is basically, the in the veins, there is like an inner lining. That lining we call endothelial. So in that lining, when there is an injury can happen. Usually injury happens when you poke from outside, right? Maybe due to IV cannulas, right? Or catheters, the one you put in the IV cannula or catheter, or maybe it's because of surgery happen in that area and we poke from outside, right? So that injury can further leads the formation of the DVT as well. The third most common reason we call under this triad is the hypercoagulability, which means too much thick blood in here, right? And that's usually happen due to multiple reasons, maybe due to pregnancy, right? Or someone taking oral contraceptives since very long, or maybe someone has a cancer problem or not enough drinking the fluid enough. So if not drinking fluid enough as well, definitely that makes the blood more thick. So you want to give DVT person more hydration for sure in the nursing intervention. Genetic clotting disorders, maybe it's a genetically problem. That's why this condition happened, right? So these are the three most common, you can say, which comes under the reason why DVT happened. But apart from this, we have the other conditions as well to consider. For example, if someone is too obese, right? That can put the risk to the person to have a DVT at some point, or maybe someone is smoking since very long, because nicotine can also affect your blood circulation. And then advanced age, so the older you get, the more chances to get the DVT, because you don't have enough mobility now, right? Postpartum period, right? So in the postpartum, like a more bed rest, and definitely, especially after the surgery, the mother could be at the risk for the DVT as well, because she don't have enough good blood supply like below that area, like after she get delivered, right? So this is we call in which conditions the DVT can happen and what is the DVT, right? I hope it's clear so far with everyone, but something is not clear. I always say is type like your best, your questions in the chat box for me. Now let's move on quickly. If you have this patient in front of you in the emergency or where you're working as a nurse, how would you know someone has a DVT? right? So you look for these signs, the one I'm going to highlight it right now. The number one, you will see that leg, the one you're doing assessment, right? It's actually becoming swollen, right? And lots of edema, lots of swelling. And when you try to touch it, right? Not with a gloved hand, when you try to touch it with your clean hands, you will see the skin temperature is more like a warm. And when you look at it, it looks more red also as well, and more tender on that vein, right? And also the patient might gonna tell you, I feel pain as well, or cramping in my leg, especially it's in my calf, when they will try to point out more towards the calf. You can actually also check this one by doing a Homan sign, but just so you know, Homan sign is not 100% accurate to diagnose someone for DVT, right? It can be false results as well. So Homan sign is what? Homan sign is nothing, when you try to hold the foot of this patient and do the dorsiflexion further, right? You will see this patient will complain the pain in the calf at the same time when you do with the foot like this, right? So this is we call Homan sign. But as I said, it's not always the accurate assessments as well. And sometimes, when you look at the leg of that patient, like the veins, which is visible from outside, it looks more dilated, right? And also, sometimes they say the patient not even complaining anything, but the DVT could be there, right? Maybe only one sign you notice, like why the legs suddenly become swollen. And I don't see anything else is in here. Maybe it just started, right? And patient not complaining pain so far yet, but it's going to be happen at some point pretty quickly. So you have to do something as a nurse at that time again. So what are you going to do as a nurse? Let's look at your nursing intervention right away. So in the nursing assessments, make sure the first thing you need to know, like do something, before it get happened. So try your best to do some preventive measures first, right? So what you can do that if you do have a surgery patient, like post-surgery patient, right? Try your best to ambulate the patient as soon as possible because you want them to mobile and be good further with the circulation, right? Sometimes you can also use some compression devices from the outside, just like which put the pressure on the top of the leg, right? These devices we call sequential compression devices, right? Those students who don't know how does it look like, it's a simple device basically. You can say it's like a wrap on the top of your leg. So you can putting like a pressure by using something like a small device on it. So why are you doing that? Because you want the legs to get further good in the circulation, right? And start moving with the blood. Apart from this, you can encourage your patient to do some exercises maybe, right? Especially some ankle related exercise if they can, right? Also, teach your patient to avoid crossing the legs or to sit for long period of time. This is not a good idea because it will impede the circulation, right? So they need to walk more if they can rather than to sit more or stand more in a one position. And then maintain the hydration as well until unless maybe doctors say restriction for some reason, but usually doctor never says in DVT, we must need to maintain the hydration in there, right? Because if you maintain the hydration, as I said, the chances of the coagulation clotting will be reduced. Now, once your patient got DVT, what you can do as a nurse? Bed rest, right? Bed rest is recommended once the DVT is there. This the first one we discussed, like before something happened, what you can do. But now if the DVT is already there, bed rest is recommended at that time. Why? Because now if your patient walk, that thrombus is actually can move now towards the lung, as I said, and it can create another medical emergency, as I said in the previous slide, pulmonary embolism. You don't want that, right? So once your patients start complaining of pain in the calf, tell them to lie down in there, stay in the bed. And also elevate the affected leg. Do not try to massage it, please, because you're making things worse further. And apply the warm, moist compress at that time because you want to thin the blood in that area. And you can give some medications as well to break that clot as well, or to make it thin the blood a little bit in there. So those common medications we actually have on the right side of the screen also at the same time. Let's see that together. The first one, immediately what you can give to someone in that case is the heparin. Heparin is usually recommended by IV or either subcutaneous method in that case, and it's a very fast acting. So definitely heparin is the immediate part of the medical treatment among the drugs, right? Apart from this, you can also recommend them low molecular weight heparin as well. Low molecular weight heparins examples are enoxaparin, deltaparin, right? So parin at the end again. So those ones are the low molecular weight heparins. Apart from this, once your patient getting stable, now your patient needs something long-term prevention, when they're going home or still in the hospitalized, then you can recommend them some oral pills like warfarin, right? So, but make sure when your patient is on warfarin, you always check the INR and make sure it stay between 2 to 3. And we will also discuss these meds in detail when we will have the medication class. Okay. Medication class is coming one lecture more, I guess, on the disease condition, and then the medications will start right away, which is I'm hoping. So when we will do the meds together, you will learn all those more information back again with me. So right now, if you cannot remember, that's okay. You will still learn the meds detail in with me. Apart from this, the next one we have is this is again your oral anticoagulants. These ones examples we have is the apixaban. The common example is Eliquis, right? And these ones are usually effective if you wanna prevent also the DVT in someone, or maybe now it started, now it's stable, climbed a little bit. Now you want the further prevention and a part of ongoing treatment. Then you can also give this medication in there. They both are like orals. Now, emergency clot breakdown. Okay, this is a very important medical emergency, I would say, the medication which you can give. Those ones are thrombolytics. Again, thrombolytics we will discuss in detail in there, but right now I want to tell you the example is the alteplase. Alteplase is basically we use if someone is already at the risk now for pulmonary embolism because they already clot moved, right? Or in severe DVT cases, we use the thrombolytic medication because you really want to break down something right away, right? Not just thinning the blood, you want to break it down right away. So you give thrombolytics at that time. And apart from the medications, as I said, during DVT, also check the signs of pulmonary embolism as well. So like if a patient is saying suddenly shortness of breath, chest pain, tachycardia, those are the bad signs. You need to do something right away as a nurse. So that's all about the DVT until here. Any doubt, any questions? I hope it's easy, it's simple, nothing complicated in here. But you can always let me know if you still have any doubt, any questions in here for me. If not clear, you can tell something in there what's not clear. If clear, maybe just say clear for me. That will be great, okay? Let's see here. Okay, I got some clear on the screen. I hope rest everybody clear with this one too. Okay, perfect. Now let's get started with the next topic on the screen. The next topic we have actually here is the venous insufficiency and peripheral artery disease, right? The first we will discuss the venous insufficiency. In a simple word, if I say what is the venous insufficiency, if you want to remember one word for this diagnosis, I would say, when the veins, uh, actually the veins in your foot they get weak now, right? And they're not working that way with the blood supply. So that is a one word if you want to remember, just for something easy to recall for your examinations, right? But let's see what the medical term says here. What's the main problem in venous insufficiency? Why this is happening in there, right? The main problem is the veins cannot return the blood back to the heart effectively because, as I said, they become weak and they become really tired, right? The most common reason I would say for this problem is varicose veins, or maybe there is a valve damage inside, or maybe someone is standing, prolonged period of time. That could be the main reason behind why the veins in there, they're not returning blood back to the heart right now, right? Maybe let's try to give you another simple example so you can remember this diagnosis for long term. Let's say, for example, if I'm coming to home right now, imagine, right? And when I'm coming to home right now, maybe I get so tired because I was at work, you know? So I get so tired. I'm like so slow when I'm going to home, right? So slow walking and everything. So why I'm so slow everything in here? Because something happened, right? What something happened? Because I was standing for too long at work. I'm so exhausted, so tired maybe, or maybe I have a varicose veins maybe inside with me. So that's why maybe I'm tired. And I cannot come back to the home right away, right? Why I'm choosing this simple example as a routine example and a funny example as well, because when you remember these silly words, I think you can remember the, medical condition right away in your examination. Because in the exams, you have so much pressure, believe me. And then you cannot recall what is venous insufficiency when you see in the computer, right? But if you remember this silly example, in that time, hopefully you can recall like the veins are not giving blood back to the heart the way they're supposed to be. So they're getting slowed down, right? So that is why, the blood will be, start accumulating in the legs, in the feet, because they're not returning to the heart right now. And definitely skin color will be changed, right? So what could be the skin color? You will see dark discoloration, right? Or some brown spots you will also see in there in that skin, right? And also, usually it's a lot of fluid accumulating there, a lot of blood is accumulating there. So when you touch the leg or the feet of the client, it's too heavy, and they look more warm, right? And also, the patient might gonna explain it to you, in the daytime, I'm okay. But in the evening and nighttime, I'm really bad because I'm in so much pain in my legs, right? So this is how they're gonna usually describe you, but they don't feel pain during the sleeping time in the nighttime. But yeah, by the end of the day, their legs get tired, right? And apart from this, as I said, too much fluid into the legs throughout the day. So you will see like edema, swelling, pretty much common in here, right? Pulse is still present. It's not absent yet when you check it. But yeah, some ulcers could be there too, right? Those ulcers, when you see them, they usually looks more wet to you sometimes or more shallow in shape, right? They're usually close to the ankles as per the books, but I think sometimes we don't just find in the ankles as well. It could be on the top of the ankles too, in practically, if I say. But for these patients, how you can relieve, too much pressure in the leg, too much blood in the leg, in the feet, how you can relieve it. You can actually teach your patient, elevate your feet, elevate your legs, right? So they need to elevate it so the more return can come back to the heart, right? Also, maybe you can teach them compression stockings as well. Now, compression stockings are pretty much definitely helpful, especially when someone has a prolonged standing type of work related job, or maybe they're going to work or school. So if they are like, all the day they're in standing position somewhere, it's compression stocking recommended so they can hold on the pressure in there. Apart from this, remember, as I said earlier, usually it gets worse when it's in a standing or sitting position for too long. But yeah, it can better if you elevate the legs of that person. Now, this is a common information on the venous insufficiency. What is the venous insufficiency look like, right? I can see a comment on the Zoom right now. Someone family member has this type of condition. So I'm sorry to hear that as well. Because I know with this condition, it's so hard to live with because it's usually give you a lot of pain by the end of the day. But yeah, always maybe teach as a nurse to your family member, or maybe if someone you know in your life they have this kind of problem, you teach them, elevate your lights as well as much as they can. Try to make a balance, throughout the day. Teach them not to stand and for the prolonged period of time. This is usually better for them. Now, quickly going to your books, I'm going to use your Sounders book as a part of reference right now. Those who have a Sounders book, it's good. You can pull this venous insufficiency with me topic if you like it. This is in your cardiovascular system right now. If someone has a ninth edition, they can tell the page number, or fourth edition, South Asian edition, they can tell the page numbers too. I have a different edition with me, guys, right now because I usually keep the one book because I teach everywhere all over the world. So I only keep the one editions with me, right? So for me, I have a Canadian edition right now with me at this point, but it's exactly same copy paste what the other conditions look like. So this is on your page number. Let's see here. After the heart failure, let's see. It should be here. Yeah. Okay, I find it. So you will see this one after cardiomyopathy. After cardiomyopathy, you will find this topic, venous insufficiency, right? Let's see, someone put in the comment section, maybe they know the page number. Yep, 746 for the ninth edition, page number 746, the venous insufficiency. If you want to see the interventions a little bit with me, what are you going to do as a nurse? So basically, as a nurse is in here, as I said, the first most common nursing intervention, you need to teach them to wear the compression stockings, please, throughout the day, throughout the evenings also, if prescribed. Usually daytime is more important, but the evening time also required if the condition is getting worse. So the doctor if says that we need to wear it. And also, sometimes the patient don't know how to wear it, when to wear it, when to take it off, how to take it off as well. So you can also teach them as being as a nurses as well. They need to wear it, when they just woke up, when they're inside the bed. So don't put the legs down there first. They need to wear the stockings first and then come out of the bed, right? And also when you need to take it off as well, when they're going back to the bed, then you take it off as well. So don't take it off first and then let the person go back to bed. Okay. And apart from this, you can also teach them, as I said, this is a repeat one, like avoid prolonged sitting, prolonged standing, and also maybe teach your client about the not to wear too much tight clothings, because tight clothing's definitely not good for the circulation in there. So not tight clothings and no crossing legs as well. And also, when they're elevating the legs, it's a good idea elevate it for about 10 to 20 minutes each time, right? And they can, elevate the leg as much as they can, but usually we recommend every few hours if they can do it, right? Now, apart from this, as I discussed earlier, there is like a machine, a device, sequential compression device. So you can also see if the doctor maybe give an order for that. So you can also use that machine for this client too. And if you're using this machine twice a day, one in the morning, one in the evening time, if it's required. And if the patient already have an ulcer, you need to look after for ulcer and provide the good wound care dressings if it's required as well, right? So this is a brief information, what you can do with this client with the venous insufficiency. Now let's compare to the right side of the screen quickly. Who is the peripheral artery disease, right? Like which client is this with the peripheral artery disease? Now, peripheral artery disease, I would say one word, if you want to remember it, um, like in venous insufficiency, you see a lot of fluid, in the legs, in the feet also. But in the PAD, peripheral artery disease, you will see there is not enough blood supply towards the leg or the feet, right? As well. So supply is getting reduced now in the down. And that's definitely not a good back again. We need to do something there as well because it will again create another problem. So let's see here. The medical definition says here the problem is the arteries, they cannot deliver enough blood, right? So the problem is here's no blood, like less blood. So you can say less supply of blood. I should not say no blood, but it's a less supply of the blood, right? So the flow is just getting reduced now in here. And obviously, if the flow is getting reduced, the circulation will be again affected. The color of the skin will be changes as well. So it will be more pale, more cool, and usually looks reddish in there. This is what you're going to see. And the patient always describe you like in this way, my feet are so cold. My leg is so cold, right? Even if I take some blanket, it's still so cold, right? So this is how they usually tell you. And they don't feel pain during the rest time. They only feel the pain, remember, when they walk. So when they walk, they feel a lot of pain especially in their foot, I would say. Legs can be also affected at the same time, but the foot is really affected. And that condition we call, when they feel the pain when they walk, we called it claudication, right? And remember, during the nighttime, while they're sleeping in the bed, they also feel the pain at that time as well. Like not in the venous insufficiency, we see they feel pain when they are in sleeping position, in the nighttime. But yes, the PAD feels the pain at that time because they don't have enough blood supply in there. Everything is so empty, right? And it's a lot of pain is available in there. So you need to make sure you teach your patients elevate the legs with a pillow in this case. Now, we don't have enough supply in there, so you cannot see edema, right? Not usually you're going to find in there, but yeah, also the pulses is going to be affected. So when you check the pulse, usually you don't find it because it's so cold and cool and clammy skin is in there. And also, the ulcers are also present, but here ulcers we call arterial ulcers, not the venous ulcer. And the arterial ulcers, they are usually more dry, more deep, and more painful actually, as compared to the venous ulcers as well. And how you can tell this person how to relieve the pain and everything, how their condition can be better. You always tell them dangle the legs. Okay, dangle the legs is a better idea. So when even they get up from the bed, dangle the legs means put the legs, towards on the side on the bed first, hang basically freely in the air, and then after that stand up basically. So they need to dangle it for some time, right? And rest is also recommended because with the rest also the pain can be relieved, but dangling is more important. And remember, if they do elevate the leg, that actually make it more worst, this PAD condition. So you try your best not to elevate it. You only elevate it if in the nighttime they're feeling the pain at that time. Only during the pain time they can. Now, the main reason why PAD happen, I would say usually when someone has already diabetic condition before, or maybe they're smoking since very long, or maybe again a fatty deposition in the body, you can say atherosclerosis condition, right? So those type of client, they usually suffering from circulation problem, which is the peripheral arterial disease condition. Now, one quick thing before we wrap up the both topics together, I actually want to tell you the easiest method, one of the another thing as well. Because a lot of time, again, when you're in the exam pressure, you forget which one dangle the legs, which one elevate the legs, right? I have an easy method to remember it the way I remember it, right? So V, if I draw the V right now, maybe my drawing is not good, but you can understand. So see if it's a V, right? You see the V arrow is up. V arrow is up, right? So if the arrow is up, you want to elevate the legs here in this condition, right? But if you see the arterial one, you see A, and A arrows go down, right? Easy way to remember. That means dangling, right? You want to put the dangle like this to relieve the pain, right? So dangling will be in PAD, and V is the venous where you can think about the elevation of the leg or elevation of the foot. This is the easiest method, I think, to remember it. But if you do have a different methods, you can always let me know in the comment section because I would love to learn the different methods from other students as well. Now, moving back to the PAD, some common nursing interventions, if I want to talk about it before we wrap up this topic today. So the few common interventions I would say, definitely everybody assessing for pain, color of the skin, pulses, sensation for sure, or the signs of ulcer, how does it look like? But let me see what's the most important. I think we already covered that earlier too, but I want to make sure I'm not missing anything from your books too. Um, Yes, this is a good point actually in your book. They said instruct the patient to walk to the point of the claudication, stop and rest, and then walk a little further. This is a good idea actually. Remember, the pain actually happen when they actually walk, right? So they can walk until they don't feel the pain, right? And when they feel the pain, they need to stop and rest in that position right away. Maybe get a chair or something in there, or maybe lie down if they can. And then after that, they can start walking back again when they feel better. So this is a good point. I think it's a good instruction to teach someone if there is a patient, in front of you. Apart from this, I can also see this is a very interesting another nursing intervention. They said instruct the client to avoid the exposure to the cold. So wearing socks is a good idea because you're already feeling so cold, right? We don't want any further vasoconstriction here. So it's a good idea to make their, feet more insulated with the socks or maybe with the good shoes. You can put it on all the time. Something make it feel more warm. No, that is the only I can see the major one in here. Not to apply direct heat on the limb. So don't apply any heating pad, any hot water pad in there because decreased sensitivity already there in that leg and they can't understand if they're feeling burn or not. And what if the burn gonna happen? Because they don't feel it, any sensation in there. So don't apply the hot compress or hot heating pad in these clients, the PAD ones. That is the only major I can see. And the rest I think I already cover up. And in this way, we cover the both conditions together. Now, any questions, any doubt for me before we go to the next slide, everyone? We covered all three topics together today. Okay, there's a question I don't understand actually. It's by Mahindra. Most common artery PDA in effect. I'm trying to understand your question actually, but I don't understand. Maybe if you want to rephrase in a different way, that would be great so I can address it for you. Any other student has any other doubt, any question for me? Even the YouTube students, any doubt, any question for me, or is it clear on YouTube? Students, any doubt, any question for me, or is it clear for you? I want to make sure everybody's in here and you're still learning, you're still listening, right? So try your best to participate as much as you can, guys, because on the next screen, not me, you're gonna participate here actually. Okay, so let's see on the next screen right now. You got a question, it's a question time, right? So let's see this question together. The nurse cares for the client admitted to the medical surgical unit with the DVT of the left leg. Now, which of the following does the nurse anticipate as a part of this client interprofessional care, right? So if you look at the keyword, I can see before the last line. So if this is my last line, those who also know me from the previous classes, I always say find the keyword into the question, right? And keyword is always hiding before the last line. So your last line, I can see before the last line, you have DVD, right? So this is your keyword. And what are you going to do in the last line as well? Which one you're anticipating as a part of the team care member right now for this patient. So select all that apply, right? So you only pick basically that answer which you know, something you don't know, better not to play. So let's use your chat boxes, please, and see if you know the answer or not. Then I'll tell you my answer as well at the same time. Maybe I'll make you guys unmute a little bit as well. Hold on. Maybe let's see if someone want to participate together with me. Hold on. I'll make you guys unmute for some time. Unmute. Yes. Okay. Your mics are unmute right now. If someone wants to come to the class, unmute your mic, okay? And try your best to participate to this question and then tell me which answer do you think. Just try your best. Even if you're making wrong, you will still learn something with me today, right? So what's the answer do you think? Select all that apply. More than one answer may be correct, but we don't know how many. Any volunteer who wants to come forward, please? Okay, Tessie, Pallavi. Maybe I'll pick now if there is available, someone is available. Binal, Desis, Gurpinder. Let's see these students first, then I'll call for the other students also. Or maybe any volunteer who want to come in the front.
Interprofessional care means
Interprofessional care means the other team members. We have a lot of other team members on the floor, like doctor, pharmacist, charge nurse.
multidisciplinary team.
Yes, multidisciplinary team. That is another word for this one. Very good. So which team do you think you want to be a part of this patient?
Two.
Two, very good. So let's keep the two in. Two is also in one of my answer lists as well. Very good. Try your best, Tessie. I know exams are coming soon for some of you. And only pick that answer which you know in SATA. Something you don't know, better not to play because you don't want to lose your score.
Because third one is wrong because pharmacist confirm the client's wait for dosing of enoxaparin.
But why this is wrong, you think? Why this is wrong, you think? What makes you think it's a wrong? Maybe share your thoughts, Tessie.
Pharmacist confirm the
Okay.
no.
Here is a tip for all of you. Okay. In SATA question, always think good idea, always think bad idea. Okay. So I'll tell you how I handle this question now, everyone. Okay. So the first one says doctor, healthcare provider, right? Order the 1000 ml per day fluid restriction. Can we do that? Good
No.
idea, bad idea?
Bad idea.
Right? Very good. And then a physical therapist assists the client in ambulating in the hall. Good idea.
Yes.
Nothing bad if
Good
someone is helping in the ambulation in here, right?
Good idea.
And then it says the pharmacist confirmed the client weighed for dosing of the enoxaparin. Now, some
Yes, good
students,
idea.
they think like overthink too much, like pharmacist or nurse, who's supposed to ask this question? They are not asking you question here, who's supposed to ask this question? Remember that. They are just simply asking you inside a question if it's a good idea or if it's a bad idea. So ask yourself, if pharmacist confirming about the dosage, there is nothing bad in there because they need to prepare the meds too, right? So
Because
this
we
is
are
good
sending
idea.
the prescription to them.
Yes, we are sending prescription to them as well, and they need to make the medication for them too, right? So it's a good idea. It's nothing a bad idea, right? Then a dietitian counsel the client to increase the intake of kale and spinach when someone is already taking warfarin. Increase it. Good idea, bad idea?
Bad idea.
Bad
Bad
idea.
idea.
There
Because
you go.
spinach increase the vitamin.
Yes.
Potassium.
So with the vitamin K, you don't want to increase the kale and the spinach at the same time, right? Otherwise, it will not be effective. Now, the last one you have is the UAP, apply the lotion and massage it.
No. Bad
No.
idea.
No.
Don't
Bad idea.
massage.
Take it out.
One,
So the final answer we have here, everyone, is 3, 2,
2
and
and 3.
3. Very good. Okay. Let's try more question with me together today. I bring some questions today for all of you. The nurse is assessing a client again with the chronic venous insufficiency. Try your best to remember venous insufficiency, right? And the question says which findings. So you have 4 findings in front of you, but that require immediate. Now, when the word comes immediate, I always tell everyone something, you can't wait for it. You have to go there quickly. Maybe a medical emergency right now or could be happen soon, and you don't want to waste your time. So when the word comes immediate, be alert, everyone, at that time into your question. So when you see 4 options in front of you like this, let's ask yourself, okay? The first one says pain in the calf area. Oh, good or bad? With the redness, swelling, and warm.
Bad idea.
Something
Bad.
happening. It's a
Bad idea.
bad. Hold on. What it sounds like to you, all of you?
DVT.
Is it DVT? Right? Oh, question mark, right? So hold on and compare with the other option. If you have more medical emergency than DVT, then only go with that. But if you cannot find any other medical emergency, then you hold on to number 1 is your final answer. The second one says open the venous ulcer on the lower leg with the delay healing. If there is an ulcer already there and it's a delay healing, is it a medical emergency, you think?
No.
No.
And that's also expected, right? So I'm not going to look into right now. Itchy rash. There's a rash, okay? Rash is there, which is crusty or itchy. Rash
Not
is a medical
emergency.
emergency? No,
No.
that
No.
can wait.
No.
Sounds like maybe eczema or something, but that can wait, right? And the last one you have is edema, dull pain after standing too long. Can someone die with the edema?
No. No.
First
No.
No,
ma'am.
Even if I give you
First
guys
is
here like +2 edema, +3, still my answer is same. So a lot of time I have a students in my past I have seen, they are like, ma'am, it's +2, it's +3. We have to do something. Well, patient is not going to die with that. Patient can wait with the edema symptom, right? So the final answer for this question is number 1. Let's try the next question, please. Pretty easy. So in this question, why did I bring this question today? Because I want to assess your knowledge from the yesterday class right now, right? So the yesterday class was on the heart failure, right? Okay, so just give me 1 second. Somebody's mic is on the higher side right now. Hold on. Only unmute the mic, guys, when you need to participate, okay? When you have a background noise in front of you, don't unmute at that time because it's disturbing then someone in the class, right? Okay, so let's check your knowledge from the yesterday class as well at the same time related to the heart failure. Very simple question. Which finding do you think will support the diagnosis of the right-sided heart failure? Select all reply. I'll wait for the answers now. It's a very easy question.
1 and 5.
1 and 5.
1,
Because right side.
1.
Left side is a lung included. Dyspnea,
Okay.
crackles.
Okay. What do you guys think about number 4?
Not sure.
Not
Not
sure.
sure.
But do you think edema can happen with the right side?
Yes.
Yes.
There you go.
Yes.
Yeah.
And left side, the left side
Ma'am,
also can
there is
happen.
a situs, edema, and JVD.
Mhm. So this one you will go with the left
Left
one,
side.
right?
Yes.
Left
And the
Left
rest of the
lungs.
options you want to go with the right one. So the right answer we have here is 1, 4
4 and 5.
and 5. There you go. Very simple question. But this simple question repeats a lot of time, just so you know. Okay. Okay. So the next question we have on the screen is the nurse is planning staff education program about skincare for the client. Again, it's a chronic venous insufficiency. Which information you want to include as a part of the one teaching program you're doing right now? Which something you want to include in here? Number one, apply moisture to the lower extremity to prevent the skin breakdown. Ask yourself, venous insufficiency. In venous insufficiency, why do we apply the lotion? Is the skin is already too moist or is it dry? Can we apply or can we not apply? If you're not sure, don't delete it right away. Hold on for now and compare with something else. You will still find out the answer with the elimination process. Okay. So maybe I'll hold on for now. And the next one we have is change the Una boot dressing on the venous ulcer daily. Do we have to change the dressing daily there or only when it's required or maybe once in a week or so, right? This is what I will think about it. Am I going to open the dressing again or again and again in there every day, right? Now the rule of elimination says you must have to delete one of those before you read the option number 3. I always teach this stuff, right? So between 1 and 2, which one you guys want to keep it in? Which one you want to take it out?
Second take out.
Second take out. Very good. I'll take out the second one too. Okay, let's keep the first one in. Now between 1 and 3, apply iodine to the venous ulcer. Iodine? Can
No,
we do that?
no, for
Okay, irritation may be more in there. Let's take it out. So now between 1 and 4, avoid putting compression stockings. Should we avoid it?
ma'am.
no,
No,
actually,
no.
Like how to put.
We
compression
need to put it.
stocking.
We just read about it, right? So the only left answer we have is the number
1.
1. So sometimes, I know in the real exam, the brain doesn't work and we don't know if we need to apply lotion or not, what the NCLEX is asking here right now. In that stage, leave that option in for now and compare with rest of the one. Use elimination method smart way and see which one answer is left at the end of the day, right? One more question before we go today. The nurse is caring for the client with the suspected chronic venous insufficiency again. Wow, favorite diagnosis today seems like. Which of the following finding would support a diagnosis of the chronic venous insufficiency? How would you know? When you look at something in the bottom, seems like a chronic venous patient in front of you, insufficiency. So I'll wait for the answers maybe, and you guys tell me when you find out the answer. Use your mic maybe or chat box.
2.
Okay. Someone says 4 in the chat box. Any other answer? Or that's the final answer? Okay, Praveen also says 4. Very good. Keep going, everyone. Try your best. The more you participate, the more you will learn. If you're not participating, just listening me, believe me, you will learn halfway only. Okay, so even if you want to tell me some guess answers too, try your best to participate always in the class, because that is something gonna make you learn a lot with me. Very good. I can see everybody's 4 in here. Very good. The right answer is 4, everyone, for this question. The YouTube students, I can see your answers too at the same time as well. So the right answer for this question is number 4. You can always stop me if you still have any doubt and you want me to explain something else is in here as well. And yeah, that's all about for today until here. Now, today I want to give you guys a homework actually before we meet tomorrow in the next session. I want you to learn something a little bit on the aortic aneurysm. So when we start the class tomorrow, right, I'll see if you understand anything or not on the aortic aneurysm. Even if not, I'll still explain it to you. But even if yes, it's a good idea. It will be your revision tomorrow then at the same time, right? So this is a tiny topic. I think it's a good idea to give something as a part of homework also in the classes now. And when we meet tomorrow we're going to wrap up all the rest of the medical important conditions, which I think as per the exam perspectives. So tomorrow your diseases for the cardio is going to be wrapped up. And then we're going to start the meds right away as well. Okay. So that's all about for the session today, everyone. I hope you guys learned something out of it as well. You can let me know if there is still doubt, any questions, any doubts for me as well. So I can always help you address your doubts and question before I leave. Okay, no worries. No doubts, no question for me. Yep, no worries. Thank you, everyone. No questions? Okay, perfect. If there is no question, no doubt, I'll leave the session now. And you can always connect with me back later on as well on the WhatsApp, even if after watching this video back again on the YouTube. And that's all for the session today. We'll meet you guys back again tomorrow. Thank you so much for joining today. Yeah, no worries.